Good afternoon, ma'am. I am Zyril Marie R. Sembrano and I am going to perform the IVP or IVU return demonstration. So first part, it should be the pre-procedural or the day before the procedure instruction given to the patient. Hi sir, good afternoon. I am Zyril Marie R. Sembrano and I am your rhetoric for this afternoon. So sir, before ta magsugod, unsay mo ang language preference sir?
Kahit ano na.
Sige, makasabot kay English, sir, Bisaya. Okay, sige, sir, ha? So, kani, sir, naalam ko a few questions and clarifications for your information, sir. So, sige, pangalan na to, sir?
Benjamin Matias.
Age po.
7.
How about your, ano po, sir, birthday?
November 18, 2000.
Naa ba kay, ano, sir, history sa allergy?
Wala.
Naa ba kay mga pagkaon nga dili ginakaon? Wala. Okay, sir, past, ano, sir, surgical operation?
Wala po.
Maintenance po, gamot.
Wala po.
Okay, sige sir. Unsa day atong chief complaint sir or unsa imong ginabati day sir?
Masakit po.
Dili ka makaihi. Okay, sige sir. Kana sir ha, mag-instruct ko para sa imuha namang kay IVP or IVU man sir no. Ano siya sir, intravenous, pylography or urography na siya sir. So, need jud na nga walay unod imuhang bladder sir para wala siya water dito sir ha. So, dapat need ka mag-ihi. Ihi lang tanan sir before ka matatapos. Before mag-dinner, dapat light meal na ka sir ha. Then pagkaugma, 8 hours fasting before your procedure. Then, mas maayo sir nga dili ka magsuot og sikip nga sanina para mas easier nimot hubuon ugma or isuot pud sir. Then, ayon na lang pud pagsuot og mga jewelry sir. Tas atong glasses tanggalon lang nato ugma sir ha. Then, ang kwan sir, mag-prepare lang ta kay tusukan man kaugma. So, much better lang sir kung nakay kahadlok sa mga sa kagayom. So, iison lang nato sir. Mag-ingon lang daan ka sir ha. So, napa ba kay other questions sir? Okay, sige sir, see you tomorrow po. So, now we're going to proceed to the patient instruction the day of the procedure. Hi sir, good afternoon balik sir. So, naano ta diri sir no? Confirm lang nako sir. Sige, pangalan na to.
Benjamin Matias. Ako po.
Okay. How about your age sir?
17 po.
Birth date po.
November 18, 2000.
Okay sir, gi-follow ba nimo akong mga instruct gahapon?
Yes po.
Sige sir, kay may bala na mangyapon na unya sir. Nag-follow ba ka sir or dili? So, kana sir ha, na ang procedure na to is tusukan ka sir o IV unya kay dito ipaagi ang gamot sir. Then medyo sakit siya pero kinahanglan na to ison sir para may mas paspasta din na atay scalp filming tapos post void sir ha. Then ang procedure it will take 20 to 30 minutes sir, 30 to 40 minutes depende sa imong operation. Then once sir, napa ba ka other question? Okay. So, sige sir, mag-change na ka dito og ano nimo sir, og kanang patient gown. Then, balik ka dito. So, for the second part, which is the equipment operation or the preparation of the materials, we have here the, assuming that this is a vertical IR or this is the grid or cassette. Then, we have here the contrast media. We will need a syringe. Then, we have here alcohol for disinfection. We have the grid. And we will need the tourniquet for later. Then, we have here the cannula. And for emergency, if the patient has allergic reactions, we have the epinephrine and the Benadryl. Then, we are good to go. So, hi sir, welcome again. So, before ta mag-proceed sa procedure dyan sir ha, mag-skin test ta sir para makabalota og allergic baka sa syringe sir. Water lang man niya ang laman ani sir, tapos itukok lang nako dira sir. Tapos i-check lang nato if na ay possible reaction, sir. So, kana sir ha? Tusok na ko sir ha? Okay. So, 10 to 15 minutes, okay na sir. Igna lang sir, magkatol ka sir ha? Now, we will proceed to the getting the scout film of the patient, which is an AP projection or the KUB. So, sir, mag-scout filming sa to sir ha? Smigda lang ka dali sir. So, kana. Smigda lang ka sir ha? Ayan lang ta. So, dapat comfortable ka sir? Okay lang ka sir? Okay. So, let us do the scout film for KUB AP projection. For the technical factors, the SID should be 40 inches and the IR size will be 14 by 17. So, for the patient position, position the patient into a supine position. So, now our patient is in a supine position. Then, you have to align the mid-sagittal plane to the center line of the table. So, assuming that this is a radiographic table, so make sure that it will be aligned. Then, ensure that there is no rotation of the body. So, sir, yan na. Okay naman sir, no? No rotation of the pelvis and the shoulder. And make sure to include the pubis symphysis. So, for the central ray, so the central ray should be perpendicular to the IR. So, our IR is this, the table, with centering at the level of the iliac crest. Sir, magunit ko sir, okay lang? So, iliac crest is here and up to the mid-sagittal plane. So, this is our central ray. So sir, suspend respiration lang ka sir ha. Pag muingong ko nga otong lang sir. So, mag-shoot na ko sir ha. Inhale. Exhale. Shoot. So, assuming that the cannula is already inserted and the contrast media will be administered. So, sir, mag-administer na ko, sir, ha? Contrast media. So, assuming that the contrast media administered already, and we have to wait for 1 minute for nephrogram. So, after 1 minute, the nephrogram will be, the patient will be in a supine position and the mid-sagittal plane should be centered at the table as well, or it should be perpendicular to the IR. So, you have to make sure that there is no rotation of the body. So, the shoulder and the hips should not be rotated, and make sure to always include the pubis symphysis. So, for the central ray, it should be perpendicular to our IR, and the centering should be at the level of the iliac crest. Here is the iliac crest, you can palpate it, and to the mid-sagittal plane of the patient. Do not forget to put the thyroid shielding for the patient's safety to protect the patient's thyroid. So, now, do not forget also to put the marker, the radiographic, under the bucky. Then, for the respiration, the patient should suspend the respiration on expiration. So, sir, you have to inhale, exhale, then mag-stop lang ko, sir, para mag-expose ko, sir, ha? So, inhale, exhale, and shoot. So, after the nephrogram, you have to wait for 5 minutes to perform the second position. So, the second position will be a full KUB AP projection. So, for this projection, you have to position the patient in a supine position as well. And you have to align also the mid-sagittal plane of the patient at the center line of the table. So, again, make sure that there will be no rotation of the body. So, the hips and the shoulder should not be rotated. Make sure also to include the pubis symphysis. So, same with the other position earlier, the central ray should be perpendicular to the IR with centering. So, our central ray, again, is here. Sir, magpalpate ka, sir, ha? So, at the iliac crest, level of the iliac crest of our patient, padulong sa mid-sagittal plane. So, this will be our central ray for this projection. So, Again, shielding, don't forget, and the grid marker. So for the respiration, sir, inhale, exhale, and expose. Then, after that projection, you have to wait for 10 to 15 minutes to perform the next position. So, assuming that 10 to 15 minutes already passed, so you can do a full KUB AP projection of the... So, assuming that 10 to 15 minutes already passed, so we can now do a full KUB AP projection. So, this will get the kidneys, the ureters, and the bladder of our patient. So, full KUB AP projection. Same SID, 40 inches with the IR size of 14 by 17. And do not forget to use the shielding and the IR marker. So, for the patient position, same with the position earlier. So, the patient should be in a supine position with no rotation of the body. So, make sure that there is the pelvis and the shoulder should not be rotated. And you have to include the pubis symphysis. So, for the central ray, perpendicular to the IR, with centering or at the level of the iliac crest here, padulong sa ato ang mid-sagittal plane. Respiration is suspend respiration, sir, ha? Or after ni mo, inhale, exhale, then saka ko mag-shoot, sir. So, sir, ha? Mag-shoot na ko, sir, ha? So, inhale, exhale, and shoot. So, for our next projection, you have to wait for 20 minutes to perform the LPO and RPO of this procedure. So, this will serve as to get an image for each of the kidney, the left and the right kidney. So, we're going to use same SID, 40 inches, and the IR size of 14 by 17. So, here is our patient. Our patient should be in a supine position as well, with no rotation of the body, and the So, for our patient position, should be in a supine position. Then, rotate the body. So, our first is the RPO. So, sir, paana lang kagamay dito, sir. Ana, oblique lang, sir. Ana lang, sir. Then, i-flex lang ni mo yung knees. Then, i-elevate ni mo ni kamay, sir. Ana. So, rotate the body to make an oblique position. So, the right part of the right shoulder of the patient or the right body should be against the IR, and the left side will be medyo malayo siya sa ato ang IR. Then, flex or elevate the knee for support and balance of the lower body. Then, raise the arm on elevated side and place across the upper chest. Then, make sure that you have to center the vertebral column to the midline of the people. So, for our central ray, it should be perpendicular to the IR as well at the level of the iliac crest. Sir, magpalpate ko, sir, ha? So, this will be our IR. And, kana. Para ma-visualize ato ang kidney. Then, suspend respiration. Do not forget also the shielding. So, sir, inhale, exhale, and shoot. So, same with the LPO or the left posterior. So, sir, same lang gihapon pero dito na sa tato bang, sir. Okay. So, same with the LPO. So, sir, nato gihapon dyan, sir, pero dito lang tato bang, sir, ha? So, i-flex lang nato kani. Then, pataas, ana lang ka, sir. Then, sir, i-dol-dol lang na to kaning lubot na to, sir, gamay. Dili, sir. I-adjust imong lawas dito, sir. Ana. Then, kani, sir. Sibugin lang, sir. Comfortable lang na to, sir. Ana. So, okay. So, now our patient is in a left posterior oblique position with the arm or the elevated side should be against the chest. And the knees should be flexed. Then, you have to make sure that you have to center the vertebral column to the midline of the table. So, for the central ray, same with the RPO, it should be perpendicular to the IR at the level of the iliac crest. So, respirations, sir, inhale, exhale, and shoot. So after the LPO and RPO, you have to instruct the patient to urinate to eliminate the contrast media. So, sir, maghihita sir ha, natay CR dito, tapos ihihita nan sir, kay pagka makita na to, og na pa ba ang contrast media or wala sir ha. So, naalang atong CR dito sir. Then for the last procedure, last part of this procedure is you have to do the post void or the KUB or the AP projection of the patient. So sir, last na lang ni sir mag post void ta if na ba. Then this is the position of the patient for the AP projection of the KUB. So the purpose of this post void is to know if there is a residue on the contrast media left in the urinary system. So, same technical factors will be used, 14 by 17 IR and SID of 40 inches. So, the patient will be in a supine position, sagittal plane is at the center line of the table as well, and no rotation of the body, and the pubisynthesis should be included. So, for the central ray as well, it will be at the level of the iliac crest and the mid-sagittal plane. And you have to suspend respiration on respiration. So, sir, humana ta sa atong procedure, sir. Thank you for your cooperation. So, naalang po yung mga instruction after niya ni sir. So, mag-ilista ka dito, sir, tapos balik lang ka dito. So, sir, thank you, sir, for your cooperation. So, naalang tayo few instructions, sir, para ma-eliminate yung tanan na contrast media na bilin, sir, no? So, dapat yun, sir, mag-drink ka og lots of plenty of water, sir, kay para makaihi ka and matanggal ang contrast media sa imong urinary system. Then, dili sa ka makauli, sir, ha? Hulat lang sa tao 15 to 30 minutes before ka discharge sa ni doc, sir. Tapos, mag-ingon lang ka sa nurse, sir, if na kay any allergic reaction or na kay katul-katul or ma-feel or nahilo ba ka, sir, or unsa. Then, after 15 to 30 minutes, so, pwede na ka ma-discharge. Ignalan ni mo ang nurse ni mo, sir.
Okay.
Sige, sir. Thank you.